The federal government shutdown continues, and it could last for weeks. Ahead on Face the State, we talked to a professor at The Ohio State University about the impact of this shutdown and what has to happen to get lawmakers to agree on a funding compromise. The shutdown is also causing a big problem for Central Ohio nonprofits. We look at how they are trying to perform the same services with less money. Plus, President Donald Trump creates a new website to buy pharmaceutical drugs at a lower cost. Coming up on Face the State, reaction from pharmacists in Central Ohio on how TrumpRx could threaten their business. We are in day 5 of the government shutdown, and it is showing no sign of ending anytime soon. Thanks for joining us for Face the State. I'm Angela Ann, in for Doug Petcash. The Senate voted on Friday to keep the government shut down. Republicans and Democrats could not reach a funding deal. So here are the sticking points. Republicans want to approve a 7-week extension and push all talks about health care to further down the line. But Democrats want that issue solved now. They want an extension of health care credits and restrictions on the president's ability to rescind funding approved by Congress. So what kind of impact will this leave nationally and locally? 10 TV's Tara Jabor sat down this week with a professor from The Ohio State University to talk about the shutdown and how long before we see any resolution.
Both parties don't seem willing to compromise. So in a multi-party system, what you have is the possibility, as I called it in one of my books, of nana boo-boo politics, where political office holders are being petty, childish, and selfish, and do not think about the American people, but think about their own hold on power.
Can you talk about what will be affected if or how will people notice this shutdown?
Well, that depends on how much is actually being shut down. We heard in the news that Social Security checks will continue and that a variety of other essential programs will continue. But we also know that quite a few military families will suffer for not being paid. Those who serve in the military. There are a variety of more welfare services programs that will be affected temporarily or maybe longer term. We'll see. But quite a few people will suffer from this. And with quite a few, we're talking about millions upon millions.
Gotcha. If you could estimate, which I know is probably hard, but how long could this last? Could it be a week? Could it be a month? What could this look like?
I have heard this morning that the word in Washington is that this could be about 6 weeks, which is longer than the 35 days in 2019. So we'll see.
One thing that people always ask about is travel because of TSA agents and air traffic control, because they also have to report to work but won't get paid.
Yeah.
Do you think that there could be a time when those people might not want to show up for work or, even with the military, since they're also not getting paid, that people might not show up?
Well, I'm not sure about the military because they have sworn an oath to uphold the Constitution, which I assume the TSA folks have too. But I do know that with the previous shutdown under the Trump presidency or under his first presidency, that a variety of TSA folks reported ill after a while. So, yeah, that could happen now too. I have no idea.
What could short-term versus long-term effects of this shutdown be?
Well, the short-term effects are mostly felt at the individual level, at the individual or family level. The long-term effects is that I think that America is making itself the laughing stock of the world, and that a variety of countries and their leadership are looking with quite a bit of glee at the bit of a mess that it is, and see opportunities for themselves to, how do you say that? Move around American dominance on the globe. Xi Jinping, Putin. This leads to a weakened American government.
Can you talk about how this will be resolved? When will it be over?
Tara, I have no idea. Um, I hope it can be resolved on the basis of a compromise between the two parties. I think healthcare is a pretty important and rather basic human right that the Republican Party should consider. The Democratic Party should consider some of the things that the Republicans want, but Republicans don't want to compromise or negotiate anything until after a budget deal has been reached. So they have closed off every avenue conceivable of reaching a compromise. But a compromise is the only way that you can actually govern, even in a two-party system.
What would you say to someone, because those impacted, it doesn't affect everyone, I guess. What
No.
would you say to people who, I guess, don't see the importance of this? Like, because they're like, oh, I'm not in the military, I'm not in TSA, why should I care?
That makes me think of Nelson Mandela's Ubuntu, or Alexis de Tocqueville's comment that about self-interest properly understood, the individual cannot survive without the community. And the individual, you and me, we are defined by the community in which we live and work. If we really have to be accountable only for ourselves and try to get ahead in life without anyone's help, that's pretty much impossible. Yeah, no one can pull herself or himself up by the bootstraps. Yeah. So what I say to people is that we need to recognize we are a community of people, Republicans, Democrats, Independents, that work together to make a better life. And we should not go over the backs of the American people to serve our own interests in holding on or acquiring political power.
Is there anything else that you think is important with this shutdown for people to understand, or someone that's impacted? Anything else you think would be beneficial?
I really hope that people will look more at what policies both parties propose than simply identify with a party and don't think about what they're actually supporting. I wish, and I can lay you can lay blame with the citizenry at large, that is where quite a few people do not seem to take the time to consider policy and simply say, I'm a member of this party and this is what I believe in, period. Instead of looking at, is this beneficial, not just to me, but also to society as a whole. So I'm not just blaming Republicans or Democrats, and blaming and anger. Those are unproductive energies and emotions, doesn't get us anywhere. Citizens are to blame as well. As soon as they start identifying with a party rather than with what policies would serve American society at large. And at the moment, both parties have in the past, Democrats too, played party over policy and politics for power rather than exercise politics for the people.
Thank you, Tara, for that conversation with that professor. Now, the shutdown is affecting more than just federal workers. We're also talking about support services. 10 TV's Colin Dorsey is getting a look at the one Central Ohio nonprofit trying to serve the same amount of people with fewer dollars.
Tucked away off the corner of Parsons and Broad, the Breathing Association helps people with asthma, COPD, and folks just trying to quit smoking. That's just a few of the services they provide. But for nonprofits like them, they've really been hit with a double whammy this year. First, it was the cut in federal grant money, and now they're faced with the effects of the government shutdown.
We're truly trying to stay committed. We are struggling.
Outfitted clinics and stocked supply rooms, all ready to help the community. Dr. Iyad Hassan is not only a clinician, but the man tasked with keeping it going.
With that money being delayed or not coming at all, what does the future look like?
It's very grim. I mean, we're very hopeful. We're very focused. We've been in existence since 1906. So we've either seen something similar or have faced something similar.
It's not been an easy year. Millions in grant funding has disappeared, and they had to lay off some staff and downsize some of their services. And now they're facing another roadblock. Funding could be delayed due to the government shutdown. It's not just medical services they provide. They also help people keep the house warm and the lights and gas connected, a service that brings some 15,000 people through these doors.
You know, I worked for my job over 18 years. And I'm in a position now to where I have financial hardships.
Carlina is one of the people leaning on the Breathing Association for help right now. With many nonprofits having to cut back and do more with less, she's worried about what it means for others needing that leg up.
I'm thankful that they're still here because it's slowly but surely disappearing. It's hard times out here.
Dr. Hassan says it's tight right now, not only for them, but others trying to provide services to a vulnerable community.
If it continues at the pace it is, one of our colleagues have actually predicted that 6 to 10 organizations, nonprofits like ours, may have to shut down by the end of the year.
Dr. Hassan says they'll make it through, but he's hopeful for a solution sooner than later. In downtown Columbus, Colin Dorsey, 10 TV News.
Colin, thank you. Now, the Human Service Chamber of Franklin County surveyed its members about the anticipated effects of the shutdown. They say since Inauguration Day, the responding nonprofits have laid off at least 168 people and left more than 180 positions unfilled. Also, collectively lost $33 million in revenue. 29% of those nonprofits anticipate this shutdown will affect their operations, and more than half anticipate a disruption to a federal revenue stream. President Donald Trump has unveiled now a multi-pronged effort to lower drug costs in the U.S., and that includes the creation of a direct-to-consumer website called TrumpRx, where Americans can buy medicine at discounted prices. Sources say the plans also include a deal with Pfizer to cut the cost of its medications. Details of that deal were not immediately clear, but for months now, President Trump has been saying drug makers need to lower the prices for Americans.
These drugs will be available for direct purchase online at a website operated by the federal government. We're also announcing that moving forward, all new medications introduced by Pfizer to the American market will be sold at the reduced most favored nation cost. So we'll be paying essentially what other countries are paying, who have been much lower for many, many years.
So what does this new drug program mean for you at home? Well, some family-owned pharmacies say it could change the way they do business and even threaten their survival. 10 TV's Bryn Caswell explains.
In communities across central Ohio, corner drug stores like Linworth's Pharmacy have been staples in the community for decades. Pharmacists say while cheaper drugs may sound good for patients, the math could put mom and pop pharmacies in a tough spot and ultimately patient care at risk.
Teaming with Times.
All right.
Inside Linworth's Pharmacy, owner Chad Thompson prides himself on customer service.
Things are either mailed to you or are coming that way. It's not that they're necessarily bad, it's just that where do patients get their questions answered and what do they do if something happens with their medication.
President Trump's new plan, TrumpRx, aims to cut out-of-pocket drug costs, allowing patients to buy medicine directly from manufacturers. This could mean cheaper insulin or heart medications. But for smaller pharmacies who don't have the bargaining power, there's fear reimbursement rates from insurers and pharmacy benefit managers could sink even lower. How are your margins right now?
They're pretty small.
The TrumpRx website is expected to go live sometime in 2026, but will not sell or distribute medicines. Instead, according to senior White House officials, consumers will be able to search for their current medications and will be redirected to the manufacturer's direct-to-consumer channels.
It's long overdue.
At Freedom Pharmacy in Pickerington, it's cash only, no insurance required, just a prescription. A business model switch owner Nate Hucks made within the last few years.
All of our profitability is based on our services. We don't make any money on the cost of the drug.
While Hucks has a head start over other family-owned pharmacies by already cutting out insurers, he's on board with what the Trump administration is trying.
Manufacturers, insurance companies, they're making a bunch of money. Pharmacies are making nothing.
But with direct-to-consumer options, Thad Franz, professor of pharmacy practice at Cedarville University, fears patient liability could be a concern.
Is it safe for patients to directly get their medications from manufacturers?
Yeah, it can be. I think if the checks and balances are in place.
In the meantime, as TrumpRx rolls out, both Hux and Thompson will continue providing for their customers, offering in-person care they believe is irreplaceable. Bryn Caswell, 10 TV News.
Bryn, thank you. Now it's time to turn to local politics, where Ohio lawmakers are having a tough time compromising on redistricting. Coming up next on Face the State, the first deadline that already passed and the next one on the way. Plus, redistricting is also a big topic for Dublin City Schools. We'll share the maps Dublin unveiled to change which students go to which high schools. Welcome back. Time is running out for Ohio lawmakers to bring forward and vote on a bipartisan congressional map. The first deadline came and went this week, but there are two more on the way. This week, the Redistricting Committee heard arguments at the State House about Ohio's future when it comes to voting, but nothing was decided. Here's 10 TV's Colin Dorsey.
The word fairness is not in the Constitution, correct?
I think it's pretty difficult to talk about drawing congressional districts and your representative, your voice, without talking about fairness.
Fairness and whose idea of it is right was a big focus among lawmakers. Senator Timken later clarifying fairness isn't part of the constitutional wording guiding redistricting.
This is the results of the election of Donald Trump versus Kamala Harris. We talk about fairness, we talk about data points, we talk about 45-55. Senator, what would you make of this map?
Democrats have already proposed a map, still giving Republicans the majority in the state, but splits congressional seats 8-7 instead of the current 10-5. Much of today's testimony centered around the lack of a map from Republicans.
When will the public or your colleagues even get to see it?
Is there a map? There's not a map that I know of. We're conducting hearings as we're required to do, and that's where we're at right now.
I've gone through, I'm like on the third version. I spent 40 hours probably doing these maps.
Dana Miller is one of nearly 90 people who have submitted a map of their own. His map, submitted last week, still gives 10 seats to Republicans and 5 to Democrats, but today says it could easily become 9-6, right in the middle of what Democrats want and what is currently in place.
Do you still have faith that fair maps will come out?
I don't think so, not in the current process and not in our system.
But he says he still has hope. With this deadline not being met, the focus now moves to October 31st for when the Ohio Redistricting Commission has to submit a bipartisan map.
And if they don't do that, well, the legislature gets a crack at it November 30th. In the State House, Colin Dorsey, 10 TV News.
Colin, thank you. Now, the recommendations are in for how to reform property taxes in the state of Ohio. This week, the governor's property tax reform working group approved 20 recommendations. That group worked for the past 6 weeks on how to cut your property tax bill while still funding schools and police. You can read the full list of recommendations right now on 10tv.com. It is now up to the legislature to decide what changes are made. Now, this comes as the Ohio Senate voted to override Governor Mike DeWine's veto on school property tax restrictions. That vote was 21-11. The Ohio House already voted to override this veto back in July, and this was a line item in the state budget that passed earlier this year that would get rid of replacement and emergency levies. It's the only item Governor DeWine vetoed that the legislature decided to try and override. In Dublin this week, 2 public feedback sessions got pretty heated as parents pushed back on new high school redistricting plans. Leaders in the Dublin City School District unveiled 3 draft maps aimed at balancing enrollment across Jerome, Kaufman, and Scioto high schools as Dublin's population continues to boom. Superintendent John Marchhausen says redistricting is the most economic way to handle growth, but many parents worry their kids will be split from friends and neighbors.
All the redistricting is fine. Cutting neighborhoods in half is not acceptable for us. It's just not.
We want our little kids to go to the same elementary school, middle school, high school that all their friends do, all the community members do. So yeah, it was a huge selling point for us, and we would very much have to consider our options if they redistricted the area unfavorably.
Would you consider moving?
Oh, absolutely.
I genuinely wish there was a process for changing boundaries that everyone could agree on, but unfortunately, that isn't the case.
Well, a survey is now open online for public feedback through October 24th. A final map will then be presented on November 10th. Changes will take effect at the start of next school year. Still ahead on Face the State, an election controversy in Clintonville. How an area commissioner's seat was on the line because of his campaigning in last year's election. Welcome back to Face the State. In August, Clintonville held an election for openings on its area commission. Will Klatt won his seat for District 3, but it came with some controversy. A complaint was filed by his competitors accusing him of campaigning too close to an election site. 10 TV's Carly Dion shares whether he'll get to keep the seat he won.
The Clintonville Area Commission voted unanimously to dismiss the election complaint against Will Klatt and then certified his election result for District 3.
Congratulations on your election.
That put the pressure on the board to make the decision they should have made a long time ago.
Back in August, an election was held for several open seats on the Clintonville Area Commission. Will Klatt won the race for District 3 by a wide margin. But the following week, one of his opponents asked for him to be disqualified.
We can't create a culture where when we disagree with someone, you try and throw them off the ballot or attack them.
The complaint accused Klatt of campaigning within 100 feet from the entrance of a polling location during the election, which violates election rules. That day, Klatt admits he was told he was too close, so he apologized and moved back.
The election committee acknowledges that there was no publicly identified line for poll standing, and there was no one basically coming in to vote for the first 45 minutes when I was out there.
The election committee decided despite breaking the rule, it would not have changed the results of the election and was not grounds for disqualification. Several community members spoke during public comment, voicing their support for Klatt, stating there was not sufficient reason to overturn the election results.
Holding this 100-foot thing as a reason to disqualify a candidate is absolutely inappropriate. When you're running an election, the way you'd run an election in your living room.
Which ultimately led to the board's vote to dismiss the complaint and certify the results for the District 3 race. The commission chair declined an interview and statement regarding the vote. Klatt officially takes his seat on the area commission in January. In Clintonville, Carly Dion, 10 TV News.
Well, we are less than 1 month away from the November election, but voting will get started this coming week. So here are the dates you need to know. Tomorrow, Monday, it's the deadline to register to vote. If you haven't done that yet, you have until 9 p.m. Monday to get in line at your local Board of Elections office, or you can register online. Then on Tuesday, that is the start of early voting and absentee voting by mail. Don't forget, the election is November 4th. Remember, when you go to the polls, you need a valid photo ID. That includes a valid Ohio driver's license, a state ID card, a U.S. passport, or a military ID. Now, if you don't have a photo ID, you will still be allowed to cast a provisional ballot, but you must submit a valid ID no later than 4 days after Election Day in order for your vote to count. Thank you for joining me this week for Face the State. I'm Angela Ann. We'll see you again next Sunday at 11:30.